I'm Sarah. I'm one of the psychologists in the Specialist Perinatal Mental Health Service. So in birth trauma, it's not so much about the type of birth that you have. You can have any type of birth. It's more about your experience and what happened. Lots of different types of births can be traumatic. It doesn't mean that you've had to have an emergency situation as such. It might be that your baby were in danger at some point in your birth, or you felt you were in danger. It might be that it was an emergency situation, but it doesn't have to be. It might look like kind of a normal birth on paper, but actually there's lots about how staff spoke to you, or about feeling out of control, or not being told things, or feeling unsafe for some reason is generally what it comes down to. Your baby or both of you feeling unsafe, and people perhaps not managing that, perhaps not having support afterwards. And that's when we can have kind of those symptoms around birth trauma. So birth trauma is actually really, really common. So about a third of people that give birth will say that there was some part that felt traumatic to them. Normally that kind of goes down over time, not for everybody. So about 6% of mums and dads will experience symptoms of PTSD. So the symptoms that you might be looking out for if you've had a traumatic experience might be what we call kind of intrusions. So that might be having flashbacks in the day where it feels like you're right back in the room, you're on the operating theatre, you're in hospital, and it feels really, really real. It might be nightmares, so when you're asleep it might be replaying parts of the birth, but it also might be nightmares where you have the same feeling, so maybe you can't move, or someone's after you, or it's kind of building anxiety. So there are kind of intrusive symptoms. We might have symptoms of avoidance, so often people will avoid talking about their birth even though they would quite like to. They might avoid other people with children that might have different birth stories. They might avoid the hospital and drive a longer way round to not go near the place where they gave birth. They might avoid certain things on TV, so call the midwife, one born every minute, nappy adverts, all those can be really, really triggering for people. You can come into one of our two services, so you might be referred by your midwife, your health visitor, your GP, any health professional. So there's two kind of different streams in our service. We have the Maternal Mental Health Service, and we have the Perinatal Mental Health Service, which is kind of a higher level support. The Maternal Mental Health Service is psychology led, so we would screen your referral and then we would meet with you for a couple of hours and kind of determine what level of need that you are presenting with and how we can help. If you're seen in the Maternal Mental Health Service, you'll be seen by a psychologist or a specialist midwife, and we will do work around birth trauma. If you're seen in the Specialist Perinatal Mental Health Service, you might be seen by a psychologist, an occupational therapist, a nurse. There's also medic support, nursing, so it's a slightly different shape, but both you can be treated with birth trauma in both services. In psychology, there's kind of two main therapies that we use. One is trauma-focused CBT and one is EMDR. So both of those are recommended by NICE as the treatments to use. Both of them you would work with a psychologist and you would go through your birth in a slightly different way depending on which one you have, but it's about what suits you, and we would explain both of those when you come to us. But it's a therapy that we do over a number of weeks, and it's about processing that trauma and kind of filing it away in the right place where it doesn't feel distressing in the here and now. That's the aim of those kind of therapies. You might have additional support, you might have nursing support, medics, OTs if you're in the Specialist Perinatal Service, or you might just want the talking therapy. But we will discuss that with you when you come to us.